Have you ever thought about how we could possibly outsmart our own bodies when they start to attack themselves? Well, today we're going to dive into the incredible science behind a drug called Etanercept. It's truly revolutionary, not because it uses brute force, but because it acts like this really clever decoy to calm down an immune system that's gone haywire.
So here's the game plan for this explainer. First, we'll get into the problem of autoimmune inflammation. Then, we'll uncover Etanercept's super elegant decoy solution. After that, we'll see exactly what conditions it treats, how patients actually use it, and, super important, we'll understand the risks. And finally, we'll look at its revolutionary impact on medicine. Okay, let's jump right in. All right, so to really get the solution, we've got to understand the problem first, right? And the problem is an immune system that's supposed to be your bodyguard, but it's gotten confused and started attacking the very body it's meant to protect.
I mean, think about it like this. Imagine a fire alarm that just keeps blaring, long after the fire is out. It's deafening, it's causing chaos. Well, that's pretty much what's happening in autoimmune diseases. The body's defense system gets stuck in on mode, and that leads to this chronic, damaging inflammation in places like your joints and your skin.
Now, the main culprit, the protein that's sending out all these endless alarm signals, is called tumor necrosis factor alpha, or just TNF-alpha for short. But here's the thing, TNF-alpha isn't actually a bad guy. In a healthy person, it's a hero. It's the key signal that tells your immune cells to rush in and fight off an infection or heal a cut. It's absolutely essential for a normal defense. And this really highlights the two faces of inflammation. It's a real tale of two responses. On one side, you've got the helpful, short-term kind that saves you when you get a splinter or catch a cold. But on the other side, in conditions like rheumatoid arthritis, you have way too much TNF-alpha, and it drives this harmful, relentless inflammation that just attacks the body's own healthy tissues over and over again. Okay, so if too much TNF-alpha is the problem, how do you stop it? You can't just shut down the whole immune system. That would be a disaster. Well, this is where scientists got incredibly creative, and they came up with what we can call the decoy receptor solution.
And that solution is Etanercept. Now, this isn't some simple chemical you can cook up in a lab. It's a biologic, which means it's a super complex molecule that has to be built inside living cells. To be specific, it's a fusion protein, meaning scientists cleverly took parts of two different human proteins and stitched them together to create something brand new, with a very, very specific job.
So here's how this brilliant decoy strategy actually works. First, you've got the problem. Immune cells are just pumping out way too much TNF-alpha. Then, step 2. Etanercept is injected into the body. It's designed to look just like the natural receptors that TNF-alpha is trying to find. But, and this is the genius part, Etanercept has a much stronger attraction to TNF-alpha. It's like a super magnet. So the TNF-alpha gets intercepted, it latches onto the Etanercept decoys instead of your cells. And the result? The extra TNF-alpha is basically soaked up and neutralized before it can ever trigger that damaging inflammatory cascade.
So, now that we know how this amazing molecular decoy works, let's talk about where it's used. Which specific battles is Etanercept designed to fight?
Well, it's become a cornerstone therapy for several really significant autoimmune diseases. It's used to fight the pain, the swelling, and crucially, the joint destruction of both rheumatoid and psoriatic arthritis. It also treats the debilitating back pain and stiffness from ankylosing spondylitis. Beyond the joints, it's used for the skin lesions of plaque psoriasis, and it's even approved for a form of arthritis in children called JIA.
Okay, let's switch gears a little. We've gone from the molecular level, now let's talk about the real-world experience. For a patient, how is this sophisticated drug actually used?
Well, the very first thing to know is that you can't just take Etanercept as a pill. Why? Because it's a protein. Your stomach would see it, think it was a piece of steak, and just digest it. It would be completely destroyed before it ever had a chance to work. That's why it has to be given as a subcutaneous injection, which just means a small shot right under the skin.
And for most adults, the routine is actually pretty simple and manageable. The standard dose is typically 50 milligrams, and it's just administered once a week.
And to make things even easier for patients to handle their own treatment at home, the medicine comes in these really user-friendly forms. You can get it in a simple pre-filled syringe, or, what's even more common now, an auto-injector pen that makes the whole process super quick and pretty much painless.
But of course, any medication that's powerful enough to intercept a key part of your immune system is going to come with risks. And understanding these isn't just important, it's absolutely critical for anyone taking it.
I think it's really helpful to think about the side effects in two different categories. By far the most common things people experience are mild injection site reactions. A little bit of redness, maybe some itching or swelling right where the shot went in. That stuff is usually temporary. It's the much, much rarer but more serious risks that require real vigilance.
And here is the single most important risk to understand. By its very design, Etanercept dampens part of your immune response. That's the whole point. But that also means it can lower your body's ability to fight off actual invaders, which increases the risk of serious infections. We're talking about the potential for it to reactivate dormant diseases like tuberculosis, or for new bacterial, viral, or even fungal infections to take hold.
And that risk is exactly why patient responsibilities are so incredibly important here. Before a person ever gets their first dose, they have to be thoroughly screened for dormant infections like TB and hepatitis. And once you're on the treatment, it is vital to report any sign of sickness, a fever, a cough, anything to a doctor right away. It also means you have to avoid all live vaccines, because they could potentially cause the very disease they're supposed to prevent.
Now, even with those serious risks, it is just impossible to overstate the impact Etanercept has had on the world. This wasn't just another new drug on the shelf, it was really the dawn of a completely new era in treating autoimmune disease.
If you rewind to the late 1990s, the clinical trials for this drug showed something absolutely incredible. For the first time ever, a drug could not only make people feel better, but it could actually stop the physical destruction of joints in rheumatoid arthritis. By the early 2000s, it helped create this whole new class of biologic therapies. And today, it's still a fundamental cornerstone treatment that has completely transformed millions of lives.
This quote really just says it all, doesn't it? Etanercept fundamentally changed the game. For so many people, it turned what was once a guaranteed path to disability into a manageable chronic condition, allowing them to live much fuller, more active lives.
The success of this whole decoy strategy was just a massive leap forward. And it really makes you wonder, doesn't it? Now that we've figured out how to intercept the body's own misguided signals, what's the next frontier? How much more precisely can we learn to outsmart and maybe even retrain our own incredibly powerful immune systems?